O.J. Simpson died of prostate cancer, and this afternoon we'd like to help you prevent it from happening to you. Joining us now live with more is Dr. Rupesh Parikh, a medical oncologist from Comprehensive Cancer Centers. And doctor, we really appreciate you joining us live this afternoon. Unfortunately, I have some personal knowledge of it. It has gone through my family, at least my brother had it. Early detection is the key here. It's kind of a silent killer. You really don't know you have prostate cancer until sometimes it could be too late. So early detection is absolutely critical in treating this, correct?
It is absolutely critical. Thank you for having me. As you said, early detection is definitely the key here to trying to find this disease. And that means, above the age of 50, if you have a family history at the age of 40, go in and get a digital rectal exam done, and if needed, a PSA done to try and see if there's any signs or symptoms developing of prostate cancer that can happen, certainly. So,
and the PSA test is easy to get done. It's a simple blood draw. That's it. You don't even have to fast before you get it. And they're looking for elevated levels of a specific antigen, right? It's that easy to check.
It is a simple blood test to draw. But there are certain reasons why we don't want to do it. If somebody has any acute prostate issues or urinary tract infection issues, or what we call a benign condition that the prostate is swollen, what we call benign prostatic hypertrophy, the test can be falsely abnormally high. So you have to make sure you do it in the right setting and in the right situation. And that's why your doctor should talk to you, and the digital rectal exam helps with that. If they feel a swollen prostate, they can certainly order that PSA test to follow. And if you're at high risk, there are certain situations, if you have a family history of it, if you're African American, if you're in the Caribbean, for example, these patients sometimes have a higher risk of prostate cancer than normal. So we do recommend testing for those patients sooner than later.
And if this thing goes undetected and they catch it late, the treatment options are limited. But if you catch it early, the good news is prostate cancer is highly treatable, and the survivability rates go way up if you catch it early.
Yeah, just like with any cancer, the sooner you catch it, the better the outcome, is what we always say. Early detection and prevention. Now these days, some prostate cancers are caught so early that we just recommend observation as part of treatment because they're so early in the process. It's usually, most cases, it's a slower growing cancer. But doesn't carry any symptoms, like you said earlier. So you have to be not just wary of the symptoms that people have. And if you do have cancer that is just under observation, you have to make sure you keep those follow-up appointments so it doesn't turn into something more aggressive that needs treatment. But just like with any other cancer, the sooner you catch it, the easier it is.
Dr. Parikh, thank you so much for joining us. We appreciate it. That means men over the age of 50 need to start getting checked for prostate cancer as early as possible. And that means probably finding a urologist here in town. Thank you, doctor. We really appreciate it. And hopefully that information can help save lives here.
Thank you. Thank you so much.